Hello, my name is Dr. Mate Shiluli, and today we'll be discussing sickle cell disease. We are doing partnership with Ponea Health, so welcome to this discussion today. So we have several crises in sickle cell disease. The common ones are vaso-occlusive crisis, we have acute chest syndrome, we have painful crisis, we have hemolytic anemia crisis, and then in infants or small babies, we have something called dactylitis, where we have swelling of the fingers and the extremities, and they're very painful. So for vaso-occlusive, the commonest one, where we have occlusion of blood flow to vital organs. So it could be the heart, it could be the brain, it could be the liver. So when it is have occlusion, we usually have infarcts, and thus you can have things like stroke, you can have things like myocardial infarction, you can even have painful sustained erections, and then you can have organ damage generally when you have occlusion of blood flow to those organs. Then acute chest syndrome comes when you have infections to the chest, even just simple pneumonia, but it becomes a bit worse when you have sickle cell disease. So for patients of sickle cell disease, we have different approaches to their management. The first thing we do want to prevent them from getting into a crisis, of which you mentioned we do adequate hydration, we ensure they have good oxygen supply, we ensure they are prevented from getting infections, we ensure that they don't have any sort of stress or any source of stress to their lives. And then they also need to be on some medications to also support them. And we have known that sickle cell disease, their red blood cells have a reduced lifespan. So we want to ensure that we supplement them with folic acid because they don't have enough. At least we give folic acid throughout their follow-up. And then we also need to do, we give painkillers, brufen, or we can go up the ladder of pain management based as you assess based on how severe the pain is. And then this patient also, if they have more than 3 crises in a year, you actually put them at hydroxyurea, which works by increasing the level of fetal hemoglobin, which is tolerable to the sickle cell disease than the adult hemoglobin. And then, so this patients will also need some extra vaccines that will be given by your healthcare provider when they visit their routine vaccination schedule. Thank you so much for joining me in this episode and discussion. You can book my services through ponea.com.